What's inside a pimple? Acne is one of the most common skin conditions. According to the American Academy of Dermatology, at any given time, up to 50 million Americans will have some form of acne. Acne is a common skin condition that happens when hair follicles under the skin become clogged. Oil and dead skin cells clog the pores, and outbreaks of lesions, often called pimples or zits, can happen. Most often, the outbreaks occur on the face, but can also appear on the back, chest, and shoulders. For most people, acne tends to go away by the time they reach their 30s, but some people in their 40s and 50s continue to have this skin problem. The difference between acne and pimples is that acne is a disease and pimples are one of its symptoms. Pimple popping videos are disgusting, and yet for the millions of people who can't stop watching them online, they're so deeply satisfying. There's just something cleansing about seeing so much gunk removed from the human body. But even if you're a seasoned popaholic, you might not know where all that pimple gunk comes from or what it's actually made of. That being said, let's take a look at what's inside a pimple, what causes it, and how you can treat and prevent inflammatory acne pimples. The National Institutes of Health explains sometimes a clogged pore gets so irritated that its walls break, and the body sends white blood cells, the fighters of your immune system, to start addressing the damage. This causes redness, pain, and inflammation. That's when you can end up with pimples called papules or pustules. Papules are closed red bumps that are hard and sometimes painful to touch. Pustules are what most people think of as a zit, red and inflamed with a white head at the center. According to the American Academy of Dermatology, if you experience pustules that suddenly erupt all over your face or in patches on various parts of your body, may indicate that you have a bacterial infection. If you experience fever, clammy skin, nausea, vomiting, and diarrhea along with pustules, you should go to the nearest emergency room immediately. Pustules tend to occur near oil glands, especially around the face, back, chest, and shoulders. They can vary in size from very small to quite large. The stuff you squeeze out of them is pus, which contains dead white blood cells. Dr. Sapna Palip of Spring Street Dermatology explains pus is a whitish yellow, or brown-yellow protein-rich fluid called liquor purus that accumulates at the site of an infection. It contains a buildup of dead white blood cells that form when the body's immune system responds to the infection. When the buildup is on or near the surface of the skin, it's called a pustule or pimple. An accumulation of pus in an enclosed tissue space is called an abscess. Other research says pimple pus is made from sebum that gets trapped in your pores, along with a combination of dead skin cells, debris such as makeup, and bacteria. When you have inflammatory acne lesions such as pustules, papules, nodules, and cysts, your immune system activates in this area, resulting in noticeable pus. Acne pustules have a whitish fluid inside them. As the inflammation improves, the pustules will also improve and go down. What causes pimples with pus to appear? Pimples with pus appear from both inflammation and as an immune response to the clogged substances in your pores. Pus only occurs in inflammatory acne. Non-inflammatory acne, like blackheads and whiteheads, also involve clogged pores, but the resulting comedones are filled with hardened oil and dead skin cells, not pus. However, it's possible to irritate non-inflammatory acne by picking at it so that it becomes inflamed and filled with pus. Pus-filled inflammatory acne can include cysts, nodules, papules, and pustules. What's the best way to treat pus-filled pimples? When treated, pus-filled pimples will start to dissipate on their own. You may notice the pus disappears first, then the redness and overall acne lesions lessen. Above all else, you must resist the urge to pop or squeeze out the pus. Most authorities, including the AAD, say you should always let a dermatologist pop pimples for you. At-home popping without proper technique can make a pimple worse or leave you with permanent scarring. But if you can't make it to a dermatologist, the AAD recommends patience. Avoid popping or picking at your skin, use ice to quell pain and swelling, and try over-the-counter treatments to speed up healing. This is all about what actually hides inside your pimples. Do you know any home remedies that can help acne? Let us know in the comments. Also, make sure to leave a like and subscribe to our channel.